Hey everyone, it's Dr. Mike. We all know someone who has been touched by cancer, and it can be one of the scariest diagnoses out there. But did you know that subtle changes in your body could be early warning signs of cancer? That's right, sometimes the signs aren't so obvious. In this video, we're going to talk about those silent signals, the ones you might brush off but really shouldn't. We'll cover 8 common, often overlooked symptoms that could indicate cancer. Remember, I'm not trying to alarm you, but knowledge is power. The earlier we catch cancer, the better the chances of successful treatment. So let's get informed and stay healthy together. All right, let's talk about unexplained weight loss. We've all been there. Maybe you fit back into those jeans you haven't worn in years and you're feeling great, but if you haven't made any significant changes to your diet or exercise routine and the pounds are just melting off, it's time to pay attention. See, our bodies are incredibly complex machines. When something is off, they send us signals. Unexplained weight loss can be one of those signals, and it's not one to ignore. It could be a sign of a number of things, from hyperthyroidism to celiac disease, but it can also be an early indicator of certain cancers. We're talking pancreatic cancer, stomach cancer, even lung cancer. These cancers can mess with your metabolism or affect your appetite, leading to unintended weight loss. Now, I know this might sound scary, but remember, early detection is key. If you notice you're losing more than 5% of your body weight over a period of 6 to 12 months without trying, don't just celebrate those smaller pant sizes just yet. Schedule a visit with your doctor. They can run some tests, figure out what's going on, and hopefully put your mind at ease. Remember, it's always better to be safe than sorry, right? So don't hesitate to reach out to your healthcare provider if you have any concerns. We all feel tired sometimes, right? Life can be exhausting. But there's a difference between needing an extra cup of coffee and experiencing persistent, unexplained fatigue. If you're constantly feeling drained, like you could sleep for a week and still wake up tired, even after a good night's sleep, it's time to listen to your body. This type of fatigue is different. It's not just about feeling sleepy, it's about feeling completely depleted of energy, no matter how much rest you get. You might find it difficult to concentrate, feel weaker than usual, and even lose interest in activities you normally enjoy. Now, fatigue, like weight loss, can be a symptom of many different conditions. It could be a vitamin deficiency, anemia, or even just stress. But it can also be a sign of something more serious, like leukemia or other cancers. Cancer cells are like energy vampires. They multiply rapidly and consume a huge amount of your body's energy stores. This can leave you feeling constantly exhausted, even if you're eating well and getting enough sleep. Again, I don't want to alarm anyone. If you're experiencing fatigue, it doesn't automatically mean you have cancer. But it's important to talk to your doctor, especially if the fatigue is persistent and interferes with your daily life. Our skin is the largest organ in our body, and it's constantly renewing itself, but it's also incredibly sensitive and can be a window into our overall health, sometimes revealing signs of underlying conditions like cancer. We're talking about changes in your skin that weren't there before. Have you noticed any new moles, or have existing moles changed shape, size, or color? Maybe you've developed a sore that doesn't seem to heal or is slow to heal. These could be signs of skin cancer. And it's not just about new growths. Pay attention to any unusual changes in your skin's texture or color. For example, a yellowish tint to your skin or the whites of your eyes could indicate jaundice, a condition that can be caused by liver cancer, among other things. Now, I know many of us love to soak up the sun, but remember, protecting your skin from the sun's harmful UV rays is crucial in preventing skin cancer. Always wear sunscreen with an SPF of 30 or higher, even on cloudy days, and reapply it every 2 hours, especially if you're swimming or sweating. Remember, early detection is key when it comes to skin cancer. So, if you notice any unusual changes in your skin, don't hesitate to make an appointment with a dermatologist or your primary care physician. They can assess your skin, determine if further investigation is needed, and provide you with the appropriate care and guidance. Pain is our body's way of telling us something is wrong. It's a signal that something needs attention. We've all experienced aches and pains, whether it's a pulled muscle from a workout or a headache after a long day. But what about pain that lingers, that just won't quit, even after trying over-the-counter pain relievers? This is what we call persistent pain, and it's not something to ignore. If you're experiencing pain that lasts for more than a few weeks and doesn't have an obvious cause, it's important to talk to your doctor. Persistent pain can be a symptom of many conditions, from arthritis to fibromyalgia. But it can also be an early warning sign of certain types of cancer. For example, persistent headaches could be a sign of a brain tumor, while back pain could indicate bone cancer or even pancreatic cancer. Now, I know it can be easy to dismiss pain, especially if it comes and goes, but if you're concerned about any type of persistent pain, it's always best to err on the side of caution and get it checked out. Don't try to tough it out or self-medicate. Your doctor can help you determine the underlying cause of your pain and recommend the best course of treatment. Our bodies are designed to keep blood on the inside. So, when you see blood where it shouldn't be, it's a definite red flag. We're not just talking about a paper cut here, we're talking about unusual bleeding, like blood in your urine, blood in your stool, or even coughing up blood. These are not normal occurrences and they warrant immediate medical attention. Blood in your urine, known as hematuria, could be a sign of bladder cancer or kidney cancer. Blood in your stool or rectal bleeding could indicate colorectal cancer. And coughing up blood, also known as hemoptysis, could be a sign of lung cancer. Now, I know this sounds scary, but it's important to remember that not all bleeding is caused by cancer. There are many other possible explanations, like urinary tract infections, hemorrhoids, or even something as simple as a side effect from certain medications. But regardless of the cause, it's crucial to get checked out by a doctor right away. Early detection is key when it comes to treating cancer effectively. So, don't delay seeking medical attention if you experience any unusual bleeding. Our bodies are constantly changing, and it's not uncommon to feel a lump or bump every now and then. Most of the time, these lumps are harmless, like a swollen lymph node from a cold or a benign cyst. But sometimes a lump or swelling can be a sign of something more serious, like cancer. If you notice a new lump or swelling that doesn't go away within a couple of weeks, or if an existing lump changes size, shape, or texture, it's important to get it checked out by your doctor. Now, I know it can be scary to think about the possibility of cancer, but remember, early detection is crucial. The sooner cancer is diagnosed, the better the chances of successful treatment. So don't hesitate to schedule an appointment with your doctor if you have any concerns about a lump or swelling. They can examine the area, ask you about your medical history, and determine if further testing is necessary. Let's face it, talking about bowel and bladder habits isn't exactly dinner table conversation, but it's important to pay attention to what's going on down there, because changes in your bathroom routine could be a sign of something more serious, like cancer. If you experience persistent diarrhea or constipation, or if you notice blood in your stool, it could be a sign of colorectal cancer. Changes in your bladder habits, like increased frequency, urgency, or pain during urination, could indicate bladder cancer or prostate cancer. Now, I know these symptoms can be embarrassing to talk about, even with your doctor, but trust me, we've heard it all before and we're here to help. Don't let embarrassment prevent you from getting the medical attention you need. Early detection is key when it comes to treating these types of cancers effectively. So, if you notice any changes in your bowel or bladder habits, don't hesitate to schedule an appointment with your doctor. Eating should be an enjoyable experience, but for some people, swallowing can become a struggle, and this is not something to ignore. Difficulty swallowing, also known as dysphagia, can be a sign of a number of conditions, including esophageal cancer or stomach cancer. If you find yourself having to chew your food more thoroughly than usual, or if you experience pain, pressure, or a feeling of food getting stuck in your throat or chest when you swallow, it's important to talk to your doctor. Now, I know dysphagia can be caused by other factors like acid reflux or even stress, but it's essential to rule out any serious underlying conditions, especially if the symptoms are persistent or worsen over time. Your doctor can perform a physical exam, ask about your medical history, and recommend appropriate tests, such as an endoscopy, to get a closer look at your esophagus and stomach. Remember, early detection is key when it comes to treating these types of cancers successfully. So, there you have it. 8 potential cancer warning signs you should never ignore. Remember, this video is not meant to diagnose anyone. It's about empowering you with knowledge so you can take control of your health. If you've experienced any of the symptoms we've discussed, don't panic, but don't ignore them either. Schedule a visit with your doctor. They can assess your individual situation, run any necessary tests, and provide personalized guidance. Your health is your greatest wealth, so invest in it. Early detection saves lives, and it all starts with paying attention to your body and advocating for your well-being. Thanks for watching, and take care of yourselves.